So we get a lot of versions of this question. Can I smoke cigarettes or vape while on Suboxone? Does caffeine affect Suboxone? I heard I can't drink coffee or smoke or vape right before dosing. Is that true? So let's start with nicotine. Let's think about what happens when someone smokes a cigarette or vapes. Often a person feels more relaxed, their mood lifts a bit. In the mornings, it may wake them up and just get them going. It might even stimulate a bowel movement. This happens because nicotine mimics a neurotransmitter called acetylcholine. At high enough doses, acetylcholine activates the nervous system, including the nerves and smooth muscle in your gut, hence the morning poop after the cigarette. It will increase alertness and cognitive performance. It can acutely increase blood pressure, increase heart rate, and promote something called vasoconstriction, or the narrowing of blood vessels. It also produces a hit of dopamine in the brain, which leads to that sense of reward. So, going back to the question of avoiding smoking or vaping prior to dosing with buprenorphine, aka Suboxone, there isn't much research on this, but theoretically, we know that nicotine promotes vasoconstriction, or the narrowing of blood vessels, and buprenorphine is absorbed by the blood vessels lining the inside of your mouth and under your tongue. So physiologically, it's possible that nicotine will narrow those blood vessels and decrease the amount of buprenorphine absorbed. We already know that only 20 to 40% of buprenorphine in Suboxone actually gets absorbed into the bloodstream when it's dissolved in the mouth. So why bother risk having less buprenorphine get into your system? The medication can already be so expensive. Swallowing the Suboxone will not increase absorption. When buprenorphine or the Suboxone gets into the stomach, it goes through something called first pass metabolism, which is a fancy way of saying blood from the stomach gets cleaned up by the liver, and buprenorphine simply gets broken down and deactivated by the liver. So when you swallow Suboxone, you're essentially wasting it. Plus, for folks with sensitive stomachs, Suboxone seems to cause a lot of irritation, even nausea, vomiting. So that's why we recommend avoiding swallowing it. So the TLDR version, it's probably fine to smoke or vape before dosing, but just know that theoretically it might be decreasing absorption of buprenorphine due to nicotine's vasoconstricting effects. So I encourage my patients to avoid vaping or smoking if it's possible. Caffeine indirectly activates acetylcholine receptors. So it also increases blood pressure and heart rate. It helps wake up the digestive system, and it increases alertness and cognitive performance. Hence, that morning cup of joe sometimes leads to a visit to the bathroom. But again, like nicotine, caffeine theoretically could cause vasoconstriction or narrowing of the blood vessels in the mouth, and it could decrease Suboxone absorption. But there hasn't been much research on this. And to be honest, I haven't heard about people's coffee or energy drinks affecting their Suboxone dosing. So the TLDR version, it's unlikely that caffeine is causing significant drops in buprenorphine, but theoretically, it could be affecting how much Suboxone is getting into your system.